Warum schwimmt der jetzt auch ein bisschen? Hä? Das ist ein bisschen big.
What's going on, guys? Dr. Jabal, medschoolinsiders.com. I'm currently on my emergency medicine rotation. Now, residency, at least intern year, is very similar to medical school in that you go from one service to the next about every single month. So right now I am on emergency medicine, even though I am a plastic surgery resident. And I'm very fortunate that this weekend I have a few days off, so I'm gonna show you that you can have fun while you're in residency. Right now it is Friday night. I'm about to start my emergency medicine shift, which goes from 8 p.m. until 6 a.m. So this is an overnight shift. Piece of advice for you guys, if you do happen to have one or two overnight shifts sprinkled around, then the best way to approach them, in my opinion, is to take a nap of about 3 to 4 hours right before your shift, and then nap again 3 to 4 hours after your shift. That way you're able to adjust without completely throwing off your circadian rhythm. However, if you do have a series of nights, like 5 in a row, then just sleep during the day and be awake at night. Without further ado, I need to get going to my emergency medicine shift, and I'll check in with you after. The way emergency medicine works is that you get assigned shifts. So you can work a Monday from 8 a.m. until 6 p.m. and then a Tuesday from 8 p.m. until 6 a.m., etc., etc. All right, guys, it is now 6:15 a.m. Just finished the night shift. Chat soon. The nice thing about emergency medicine is that you know exactly when you're going in and when you're going out. So I went from 8 p.m. all the way until 6 a.m. and I ambitiously planned to head over to the Grand Canyon Saturday morning. Today is now Sunday morning. We were gonna head out on Saturday, but I wasn't feeling too well. I was feeling a little bit under the weather, and the lady made a good point, which is that gotta listen to your body. So ended up sleeping in, took it easy as a rest day, and now it is Sunday morning. We are about to head to the Grand Canyon. So we left early that morning, drove all the way to the Grand Canyon, got to do a little bit of sightseeing.
And how long does this pass last? 7 days. 7 days, awesome, thank you.
So we just entered the Grand Canyon National Park. We're actually driving now to the rim. I'm super excited, I have never seen it. The lady has seen it in the past. It's gonna be my first time. Super stoked. All right, guys, so take home points from that shift on Friday night. Number one, it's very easy for physicians and surgeons to grow jaded or cynical and start treating patients as just diseases. But you have to remember that they are patients at the end of the day. And by making that connection, by treating them as people, everyone benefits. You're gonna feel a lot better about yourself, about the care you're providing, and they're gonna be a lot happier in the end. So just remembering that patients are people at the end of the day, I think is very important, not only for your own sanity and satisfaction from your work, but also on the receiving end as a patient receiving care. Number two, don't drive drunk. You'll f yourself up, you'll f up other people. Don't do it. We only saw the southern rim. We didn't get a chance to see Antelope Canyon, but that's for next time. Now this thing is truly immense and it makes you feel very, very small. A very humbling experience, if you will. So we are now at the Grand Canyon. I gotta say, it is pretty unreal. I'm used to seeing Horseshoe Bend in the photos, and this is just vast, immense, huge. It makes you feel pretty insignificant. What do you think?
It's great for carrots. No,
Nice.
It's incredible.
Great for carrots. There were beautiful views. We caught sunset at the actual Grand Canyon and it was surreal. So we're out here, Grand Canyon, sunset, day one. I mean, I'm not even gonna try to describe it. Just take a look. So after the first night, we caught sunset, got some dinner, and early the next morning, we headed back to the canyon to get a little bit more sightseeing in. Second day out here in Arizona, we're going back to the Grand Canyon, taking a second look during the daytime, and then right after that, we're gonna drive all the way down to Sedona, Arizona. It's about 2 hours. A lot of cool stuff to see there. Not as popular as the Grand Canyon, but stay tuned, really exciting stuff. Now this was during the bright day. Again, enjoyed the great views for about an hour or two, and then we headed south all the way down to Sedona, Arizona. A lot of you may be wondering, how am I able to take this time, go to the Grand Canyon in the middle of surgical residency? It's a matter of making the time, being efficient, working hard, getting your stuff done, and then making sure you take that time to enjoy yourself, take care of yourself, exercise, spend time with loved ones.
Be in nature, recharge.
Be in nature, recharge. The drive there was spectacular. The winding mountain road with the lights hitting the trees just right. It was beautiful. So driving into Sedona, we set our things down at the Airbnb and headed off to see Kachina. Now Kachina is one of these rock formations that looks like a woman with a baby on her back.
So that is Kachina because it looks like a woman with a baby on her back. Can you see that?
Yeah. Now for those of you who do not know, I personally did not know this, Sedona, Arizona is considered a spiritual vortex. I didn't know exactly what that meant, so I did a little bit of reading, and essentially there's some energy there that we can't really explain or quantify in traditional scientific terms. They call this a vortex. What's a vortex?
It's an energy field where everything is amplified. Or I should say, all emotions and energy is amplified.
I don't know if it's electromagnetic or whatever. Some people believe in this, some people do not. I'll let you decide on what you guys want to believe. It's a cool spot though. Now I had work on Wednesday, so on Tuesday we got another quick visit at Kachina and then had to unfortunately leave Arizona. Kachina here at Grand Canyon. I'm wearing my sexy hat and now we're about to get lunch and head back to California. We drove back all the way to California, taking us about 7 or 8 hours. Luckily, we got to enjoy a beautiful sunset on the way back. Now, ultimately, I want to make a few points with this video. Number one, you can do a lot in residency or when you're busy in medical school or as an undergrad if you plan appropriately. Now, the main issue with that I learned on the tail end is that sometimes we can be a little bit too aggressive with our planning. I was falling sick, I decided to still go, and ultimately it was less enjoyable than it could have been. And the second lesson, kind of contradictory to the first, which is that sometimes we need to take a break for ourselves. So keep that in mind, guys. Remember to have fun, maximize your time, but that also means taking time for yourself. I hope you guys liked the video. Let me know what you think down in the comments below. If you liked the video, make sure you press that like button, hit subscribe if you have not already, and I will see you guys in that next one.